Welcome everybody once again to Let's Talk About Sleep, where we are going to touch on all the various topics that are out there regarding sleep and sleep disorders. Just to few house cleaning things. One, this is not a medical advice channel. This is meant to be educational, so anything you learn here, talk to your provider about, whether it be your primary doctor or a sleep specialist. Definitely use this as a guide to talk to them about further steps in your care. Second thing, my book, as I always mention, it's on Amazon. Okay, the link will be in the description box below. Thirdly, if you like this video, please click like, please subscribe to my channel, and share this with your friends and family, and ask questions down below. I will try to answer any and all if they're appropriate. So, with that being said, let's talk about today's topic, which is stimulus control therapy. Now, that's a very, very, very fancy term for one of the other techniques we use in cognitive behavioral therapy for insomnia, or CBT-I. Okay, if you saw my last video, that was on sleep restriction therapy, which is basically, just to reiterate, it's basically allowing the person to spend, or having the person spend less time in bed, with the intention of increasing the continuity of their sleep and the quality of their sleep. Okay, very difficult to do, but it does work. Okay, what stimulus control therapy is a kind of a corollary to that, or something else that a psychologist or a therapist who specializes in that sort of work will have a patient do. And very simply, what it is you're only going to use the bed for sleep and intimacy. That's it. Okay, so if you're not doing either one of those things, you're not in bed. So how does that play out practically? Well, let's say what I'll tell my patients is, look, let's say you get into bed, it's 11 o'clock at night, and you're lying there, and you're lying there, and you're lying there, and 30, 40, 50 minutes has gone by. The idea would be to not just spend time in bed and keep hoping and hoping that eventually you'll fall asleep. What we have you do is say, one, without looking at a clock, all right? So, as I've said in my other videos, watching the clock throughout the night is not a good idea. So, what you do is you have the clock covered, okay, or faced away from you, or whatever it is, and instead of looking at the clock, you kind of just estimate in your mind. If you think 20 minutes has passed, right, that's kind of my rule, the 20-minute rule. If 20 minutes has passed and you're not anywhere near sleep, the idea would be to not just lie in bed and keep trying, quote-unquote, is to actually get up out of bed and go to another area of your house or your apartment or your kitchen or so, and either read on paper or listen to soft music or do some meditation, which is my favorite, and I'll have another video on that, or listen to a podcast or anything like that where you're not looking at a screen, right? Because we know about screen time that emits what we call blue light, and that can keep us awake. So instead of doing that, you're doing something which is going to help your eyes and your mind to relax until you find yourself getting into a place where, I'm getting a little bit drowsy. You get back into bed at that point and try again. Okay, that's essentially what stimulus control therapy is. Basically, you're controlling how much stimulus is associated with being with your bed, right? And the less the better, right? Like we said, sleep and intimacy, that's it. So this, along with sleep restriction, can be very, very useful in cognitive behavioral therapy for insomnia. Again, this is something you would definitely want to talk to your care provider about. But this sleep hygiene technique, or this stimulus control therapy technique, is good for sleep hygiene anyway, right? Sleep hygiene is, maybe I'll make a video about that. That's about really only using the bed, again, for sleep and intimacy, and not doing things in that bed environment that are out of that realm. So, not watching TV in bed, not eating dinner in bed, those kind of things, right? Stimulus control therapy is part of that. Okay? So, that's, like I said, that's something you should be doing anyway, but this is one of the techniques that we use. So, that's really it for today's video, kind of a short one. So again, ask questions, please subscribe, please like this video. My book, third time now I'm showing it. Link is in the description box. And until next time, everybody, Sleep well.